Thank you for having us. It's such a great pleasure working with you, Allie, as always.
Hey.
So my name is Teresa. I'm an intern and a graduate student at the Mental Health and Wellness Center at Molloy College. And we've paired with the OceansideSAFE Coalition to bring you this presentation. So welcome and thank you all for coming. As we mentioned before, we are going to record this session so that we can use it as a resource for you to refer back to down the road. And also, we'd also like to provide this as a PDF, so you can refer back to it, use any of the links and resources that we've included down the road or whenever you're ready to have a conversation about this. Does that sound okay? Cool. Thanks, Allie. So I'd like to start off by reminding everybody that October is National Substance Abuse Prevention Month. And I think that youth.gov really put it perfectly when I wanted to try and explain what this month was about by saying that it is an observance to highlight the vital role of substance abuse prevention in both individual and community health, and to remember those who have lost their lives to substance abuse. So this whole month is dedicated to those items, and I'd like for you to keep that in mind and to really, lean into the significance of us meeting today on October 1st. So today's agenda looks a little bit like this. We're about to do a check-in, and then I'm going to throw some statistics at you with Allie, and then we're going to touch briefly on alcohol use and abuse, marijuana, other substances, and then we're going to talk about linking substance use and COVID-19 and healthy coping skills, talking about substance use and modeling healthy behavior. Now, we only have so much time together, and all of this information is really important. But what I really feel like I'd like for you to walk away with today is the impact of substance use, or the impact of COVID-19 on substance use, and how it's really become a growing concern. And then, of course, I'd like for you to walk away with some healthy coping skills and some ideas to move forward with when having conversations about this. Does that sound okay, Allie and Dr. B?
Sounds perfect.
Awesome. So first, I'd like to do a little check-in. And before we start the check-in, I just want to remind everybody that there's a little chat box below. That's really how we'd like to encourage you to engage. And I just want to remind you to be courteous to your fellow guests here, and also to know that Dr. B is moderating the chat. So she's saying hi. She'll be reading aloud any comments or questions that might come in there. And I do want to let you know there's a few times that we do ask for your engagement. I'd love to hear what you think. So if you'd like, please let us know on a scale of 1 to 10 how you're feeling today. 1 being the absolute worst and 10 being amazing. How are you feeling?
We have a lot of people saying hi. We have a 7. We have an 8, 6, 9.
All right. Pretty great day.
5, 8, 7.
5 is a solid, honest answer. I appreciate that. Nice and neutral.
7. We got
great.
A lot of people in the mid to upper range. We like to hear that.
Fantastic. I hope we get to feel some of that mid to upper range energy today. So let's talk a little bit about what you know. Can you enter into the chat what you already know about substance use? Maybe the ways that it impacts you or your community, or what your feelings are around it. Do you have anything coming in there, Dr. B?
So the first comment we have is that the behaviors start young.
Great. Yeah. That's why we really want to kind of have these conversations now, so we can prepare for having those conversations and do some preventative work.
Another participant added that it's widespread in Oceanside.
Great. Yeah. The next question is, what do you know about alcohol and marijuana use in your community, Oceanside? Anything specific come to mind there? That's okay if no one's putting anything in, because we're about to have Allie tell you some really interesting information. All right, if nothing's coming in, I'm going to move on. What do you think, Dr. B?
Sounds good.
Great.
We actually have one last comment. Sorry about that.
It's okay.
There's a link to mental health there, and I think that's a really important part that in a lot of the cases, like, you can't really tease them apart because they're very intertwined in a lot of ways. So we'll talk a lot about that today.
Absolutely, co-occurring. Great, thank you so much for participating. So we have a couple of slides of statistics, and as important as this information is, we're going to kind of cruise through some of this because we're going to provide you with this video and we're going to provide you with the PDF. We really want to get to the meat and potatoes of engaging and talking and using our skills. So I'll talk about this and then I'm going to hand it over to Allie. Does that sound okay, Allie?
Yes, yes, yes.
Cool. So alcohol use affects over 4 million Americans. 2/3 of substance abuse cases involve alcohol. Marijuana is the most commonly used illegal drug in the United States. And we currently have recorded, or in 2019, we recorded, terrible at numbers, 36.6 million users. So this information is on a larger scale, national scale. But what Allie's about to tell you is going to be more specific to our community here.
Thank you, Teresa. So a huge part of understanding the culture of substance use within Oceanside is by continually collecting data. So our youth development survey, which is where we got these statistics from, the last one was implemented during the 2018 and 2019 school year, and that was in grades 7 through 12. Now this was pre-COVID, so it will be interesting to see how these numbers may have changed or may change in 2021 when we hopefully are able to collect more data for these particular core measures that I'm about to share with you. So these next couple of slides are going to give you a little bit of an idea of what substance use currently looks like within our youth, so within those grade levels of 7 through 12. So as you'll see here in the first slide, oh, I'm so sorry. In grade 7 through 12, you'll see that students reported certain problems as a result of using substances in our youth development survey. So as we see here, this represents 85% of Oceanside Middle School and Oceanside High School. So 3.8% of youth reported driving under the influence of alcohol. 8.6% report driving under the influence of marijuana. And from grade 7 through 12, 13.8% reported being in a situation they regretted due to alcohol, and 13.9% report that they forgot what happened. Additionally, what you don't see on this slide is that 7.8% reported problems with a significant other as a result of drinking. 5% reported problems at school. Binge drinking was also found to be a concern with 16.5% of 9th and 10th graders and 30.2% of 11th and 12th graders. And that's drinking 5 or more drinks in a row over the course of 2 weeks. The largest percentage of where youth are drinking was reported to be at somebody else's home or within their own home. So we can go to the next slide. So this chart here, this shows the past 30-day use reports from grades 7 through 12. So we do see a steady increase of use from 7th to 12th grade, with the most significant being in 11th and 12th grade for alcohol and marijuana. So the percentage of alcohol use within our 11th and 12th graders is actually higher than the state average. So that rose quite a concern when we were looking at these statistics. Percentage of risk and harm. This pertains to the youth individual idea of how harmful the substance is. So alcohol and marijuana, which appear to be the focal points of usage with our youth in Oceanside, they both drop from 7th to 12th grade. Marijuana the most significantly. Cigarettes and prescription drugs seem to be the ones that are pretty steady, but we still see that drop once we get to 12th grade. But across the board here, it does seem like there is some room for improvement and more education in this area. So student perception of parent disapproval. So this is pretty strong across the board here, right? Which is great. Pretty strong numbers. Youth seem to have an idea that their parents wouldn't approve, but vaping does have the lowest percentage. And right behind that is marijuana. So obviously there needs to be a little bit more of an increased education in these areas. There may be an idea that, you know, at least it's nothing worse than marijuana, right? Like it's just marijuana, or it's just vaping, at least it's not cigarettes, which we know now with a little bit more education in these areas that that's not necessarily the case. There are risks in using these substances, so that needs to be a little bit more implemented in our conversation with our youth. Okay, and then we have perception of peer disapproval. So this is what youth would imagine their peers would be against or disapprove of. So prescription drugs thankfully stays pretty strong throughout, and even cigarettes. Vaping and marijuana, however, it does take a pretty drastic drop from 7th to 12th grade. And alcohol's decline in disapproval is a little bit more steady, but you do still see that drop. But just to highlight there with vaping and marijuana, we go from 98% in 7th grade and 83% in 7th grade. It drops down to 48.3% by the time they get to 12th grade and 38.7%. So that perception of disapproval among their peers, among seeing that happening, it significantly drops as age increases. So this is something to be aware of as we're taking into consideration the overall culture and of acceptance, of availability, of the way that it's being used within Oceanside. So
thank you, Allie.
Yeah. Thank you.
Thank you, Allie. That was so informative, and I really appreciate you working with the OceansideSAFE Coalition to get this important information about our community specifically. I think it's really vital for community members to know this. And just like someone mentioned earlier, those statistics show that it's very clear that we have to start having these conversations young.
Yes, definitely.
So everyone here, are these statistics in line with what you thought about your community? Did you know this? Let me know what you think in the chat box.
Don't be shy.
Please.
So we have one comment that says, unfortunately.
Okay. So you had a sense of this is how it is.
Yeah, someone else added it's eye-opening and that they're sort of aware, and most people are saying that they are aware that this is the case in the community. And I'm guessing by the agreement with these statistics, or the understanding of these statistics, is one of the reasons why you are all here this evening.
I'm really glad to know and see everyone here today, because our hope is that making space and normalizing these conversations will contribute to making Oceanside a safer and healthier community.
Absolutely. Absolutely. The only way to change the climate and the overall idea and culture is to really understand what the issue is, where it starts, how it starts, and then we can start as a community. It takes an entire community to really have that conversation and really sustain that change.
Yes. All right, let's move on.
Okay. So I just want to throw in here that we have a comment, or a question, I should say. What can parents do? And that is something that we are definitely going to be touching on a little bit later on with our material that we've prepared for today.
Absolutely. So we're going to talk a little bit about the different substances, and then we're going to talk about some tools that we can use moving forward.
And great question.
Yes. So alcohol use and abuse. Like I said earlier, I have a lot of information here. We're going to cruise through some of these slides so we can get to some of those useful tools. So signs that alcohol is being abused: anxiety, nausea, depression, fatigue, loss of appetite, headaches. And what's key here is that you see these things outside of the typical social cycle of drinking. during irregular hours. Oh my gosh, sorry, I thought I shut the door. Outside, like I said, outside the typical social hours of drinking. So some short-term risks and long-term risks that are important to know about alcohol use and abuse are alcohol poisoning, violence, the risky behaviors, pregnancy complications, things that could readily impact your immediate well-being. And long-term risks are cirrhosis of the liver and weakened immune system, which is particularly important right now in the pandemic, heart problems, social problems, maintaining relationships, maintaining your role in your family. They're at risk when you are using or abusing alcohol. So this is some really important information to have in general, but of course for individuals over 21, what the standard drink size is. In the United States, a standard drink contains 0.6 ounces of pure alcohol, but this size changes depending on the type of drink that you're having. So for a beer, it's 12 ounces. That's the standard size. For liquor, malt liquor, it's 8 ounces, 5 ounces for a glass of wine, and then for something like a shot, like vodka or whiskey, it's 1.5 ounces. So this is really important to know when you're trying to ensure that you are meeting the dietary standards and keeping yourself safe from the risks of alcohol use and abuse. So Allie touched on this before and mentioned how prevalent it is in our community right now, what excessive alcohol use really looks like. So it includes binge drinking, which she touched on, heavy drinking, any drinking by pregnant women or individuals under the age of 21. So specifically, binge drinking is the most kind of, the most common kind of excessive drinking. It's called a bender, a night out, partying, where we consume a lot of alcohol during one occasion. 4 to 5 or more drinks during a single occasion specifically. This information I collected from the CDC, and they do specify the difference between gender and how the amount of alcohol you drink is impacted by your gender. And they do say 4 for female and 5 for male. It's something to take into consideration. Heavy drinking is defined by the amount of drinking you do per week. So 8 to 15 or more. So according to the CDC, if you're a woman, it's 8 or more drinks per week for it to be defined as heavy drinking. And if you're a male, it's 15 or more. So how do we prevent alcohol abuse? The first key is choice. Choose not to drink in excess if you can. Of course, that brings up the question of addiction and the disease that is a major part of alcohol and drinking. But with that aside, the first way to prevent alcohol abuse is to choose not to drink in excess. Know your standards. Know how much alcohol is healthy for you to ingest and intake. Knowing the dietary guidelines. So how can we prevent it? We can try to learn to socialize without alcohol. We choose certain body movements, exercising, walking, swimming, dancing as a way to cope with other things or a way to entertain ourselves. Discussing concerns with someone you trust, whether it's a family member, a friend, a therapist, someone you can confide in, who you also enjoy spending time with. And our favorite is journaling. Those are some skills that you can use when coping with things that might bring you to drink that isn't specifically socially powered. So in our community, again, knowing the dietary guidelines, the standard of drink size, support community efforts, and join discussions like this one. So thank you. Well done. And do not serve alcohol to individuals under 21 or to those who are currently intoxicated. This is how you can help prevent alcohol abuse. Some of the ways. So marijuana use and abuse. We're going to touch on some of these items here. Signs that marijuana is being abused are bloodshot eyes, weight gain, a nervous or paranoid demeanor, impaired coordination, dry mouth, slow to reaction time, dizziness, anxiety is heightened. These are all things that you can kind of pick up on. And like I said earlier, kind of outside of the typical social use cycle or schedule. Some immediate risks of marijuana are paranoia, an elevated heart rate, and impaired motor functioning. Long-term risks are lung infections, the inhibited mental ability. So it can really impact your ability to learn, to grasp information, to understand when things are happening in the moment. And this is a long-term risk. It can happen down the road. So how to prevent marijuana use? You'll notice that a lot of these are repeated because we can really use the same approaches to help prevent harmful abuse behaviors and risky effects. So in myself, of course, you want to educate yourself on the risks, knowing what could possibly happen if you choose to drink in excess and regularly. Engage in extracurricular activities like art or reading, books, sports, socializing without alcohol. Without marijuana. Carefully select individuals you spend time with. We are so influenced by the people around us. We're more likely to use if we have a group of people that we hang out with that use a substance. So again, adapt alternative coping skills. Like we said before, choose to socialize without marijuana. Learn to move your body in ways that really supports you. Discussing things with someone you trust and journaling. And supporting your community, coming to discussions like this. Sharing information regarding the risks of marijuana, having these open conversations and sometimes difficult dialogues of the things that can come up while using. And talk to your parents and children about the risks of marijuana. Dr. B, is the chat, are people coming into the chat, or am I just seeing my thing drop down?
He had one comment before, and I think it was going to be a good comment for me to bring up later, so I was kind of hanging on to it. It was that there's a sense that there's a mixed message in the culture, and I think that's what you were sort of getting at before. And I was going to bring it up when we talk about how to talk about substance use with kids, and how kids can talk to parents about substance use as well, because it's about kind of getting on that same page. So I think we're going to get back to that in just a little bit.
Great, thank you. So of course, it's not all alcohol and marijuana. There are so many other substances that we should really be aware of and talk about. Some of them are vaping and tobacco, and others are prescription drugs and opiates. There's a wide range of ways that all of these categories can be used. I would really love to spend the time and go through all of this together. But I think if it's okay with you, we'll kind of touch briefly on these couple of slides and move on. But please know that these are important areas that we should be aware of and be ready to address. So of course, nicotine and vaping and tobacco are highly addictive and can impact a developing brain. And this is both in regular cigarettes and in e-cigarettes or vaping. For the short-term and long-term effects of opiates, I have it all listed out here. It's color-coded, so when you do refer back to it, everything in blue is long-term effects and everything in orange is short-term. So short-term is dry mouth, flushed skin, all those items there. Long-term can be collapsed veins, infection of the heart, constipation. It really, really impacts your body. Some warning signs of vape use and tobacco are strange odors. This I found really interesting. Unknown packages. It's such an online culture to get a lot of the vaping products. There'll be a lot of packages you might not be familiar with showing up at the door or in the house, and that can really help signal a need for a conversation between you and others in the house. Some warning signs of abuse for prescription pills and opiates, or an increase in painkiller use, having trouble staying awake or falling asleep at inappropriate times, a flushed look in the skin, and impulsive actions and decision making. Of course, the ones that I'm actually saying are just the ones that I've highlighted, but I really think it would be beneficial for you to take some time and look through these and know this information. So the ways we can prevent: educate yourself, engage in extracurricular activities, carefully select the people that you choose to spend time with, and adapt alternative coping skills. And for your community, engage in discussions, join communities, share information about the risks, and have conversations with your family, with your parents, or with your children. So, linking substance use and COVID-19. Substances like alcohol, marijuana, vape, tobacco, prescription pills, they are often used as coping mechanisms to mask the effects of mental and emotional distress. They're maladaptive coping mechanisms, which means that they are not the healthiest way of dealing with the discomfort that we're feeling. Individuals using and abusing substances often report that the substance temporarily relieves the symptoms that they experience with their anxiety, stress, depression, trauma symptoms. But the key word here is temporarily. In actuality, substance use increases the difficult effects of mental and emotional distress. So I'd love to know what you all think about some of the difficult experiences and emotions brought on by the COVID-19 pandemic. Are like, what are the things that you've been experienced or that you've seen other people experience? And Allie and Dr. B, if you want to jump in, you're welcome to share your thoughts here.
I think it's just important to note too that COVID-19 has very much amplified the culture, the acceptance of the culture of underage drinking, of substance use. We've seen an increase in overdoses across the nation. We've seen an increase in alcohol sales, an unbelievable increase in alcohol sales. It's a lot easier to access alcohol now too. You can get it over the internet. Internet sales have skyrocketed. So the fact that it's so much more prevalent, it's so much more available, it's in homes. People are drinking earlier during the day. A lot of people are out of jobs. A lot of people are just experiencing so much stress that they don't even know how to handle it. And it's very difficult. It's very difficult for families to kind of, I guess, I don't want to say be the role models that they want to be, because that's not correct, but really just to kind of portray, I guess, the coping strategies that they want to portray, because everybody is in the thick of it. We're in the thick of it right now. So how do we do that? How do we take care of ourselves, but also send the right message at home? So I think that that's something that everybody's dealing with right now. That's something that's happening so much in homes, and it's something that we all need to really be aware of and really kind of take in. So that's just something that I feel like is just worth noting.
I love how you mentioned like loss of routine and an expectation to still maintain this like amazing sense of self and maintain all of your high standards when we're all going through this collective trauma.
Absolutely, absolutely. And everyone puts that stress on themselves. We do it to ourselves. We don't know what tomorrow's going to bring at this point. So it's so difficult to just kind of, pretend like you've got it all together, because it's okay to admit that we may not right now, and that's fine. But being aware of it and really just taking a look at how we're dealing with it. How could we be dealing with it a little bit better? How could we, be there for our kids, be there for ourselves at the same time.
Right.
Some other stressors that came in through the chat was financial stress, fear of getting sick, isolation, and really just juggling it all. And I think that's a great way to put what a lot of people are feeling. It feels like a juggling act. It really does. So those are some that came in through the chat.
Those are all heavy things that if we were dealing with those things without a pandemic, they would be difficult. And then with a pandemic, yikes. We need to find balance. When we have these stressors, there needs to be a way of coping with it. And sometimes we lean into coping mechanisms that aren't helpful long-term. Some people feel like they might be helpful in that moment, but they cause greater issues down the road. Thank you all for sharing some of your concerns and experiences with this. I know it's really difficult, and I appreciate you being open and willing to share that with us here. So,
what do you think?
Common challenges and common results. A lot of the things that we have talked about, some of the concerns that people have are becoming, some of the concerns that people have are becoming ill, being impacted by the pandemic, seeing their people, their community being impacted by the pandemic, experiencing death, processing the information about the pandemic, and all the political pieces that coincide with it. Loss of social opportunities. They are all heavy things that we need to compensate for, we need to cope with. So some of the common results of these experiences are anxious feelings, depressed feelings, loneliness, trauma symptoms. This is a big one. A lot of us don't acknowledge that what we're experiencing is actually traumatic. It's so heavy. We can be experiencing shock and denial and confusion. Irritability, come on, like sadness and disconnectedness. These are all things that we experience when we experience trauma, and they are results of also the individual common challenges. So the last one, of course, here is substance use. I love this chart. It's pretty new. So all of the data isn't fully up on it, but it's interactive. And you can really kind of choose a population that you're interested about knowing the statistics for across the nation, specifically around substance use and COVID-19. So for the purposes of today, I just put in student as the career and states as all, but they only really collected information from California and I think that's Illinois. Someone help me out. I'm not sure what state that is, but it's only 2 states. And you can see the percentages are quite high. I provided you the link for this for when you do get this PDF, so you can click on it and play around with the percentages. By the time you see it, by the time you've seen it, it's probably going to be much more expansive because they are actively collecting this data right now. So, coping skills, healthy coping skills. What can we do to cope with all of the heavy things that we're experiencing right now in a healthy way, in a way that isn't substance use? For some people, this may feel like basics and that we need something deeper, but I think it's really important to honor how supportive and how enriching some of these basic coping skills can be. So our number one, especially coming from a counseling perspective, is to talk about how you feel with someone you trust. Whether or not, like I said before, it's a relative, a friend, community member, or an actual therapist. It's a great way to relieve the weight of what you're experiencing. Connect with nature, move your body, accept that you're feeling emotions. You're human. A part of being human is experiencing emotions, just like we have arms and legs that move. We have emotions that come and go in our bodies. Practicing gratitude is a really, really popular one right now. Being grateful for all of the things we have in our life. Engaging with music and entertainment. And of course, like I said before, speaking to a mental health professional, but often also just speaking to your medical professional. You know, I'm feeling this in my body. What can I do? You know, that doesn't necessarily mean that you need a prescription. It might, but they might have some great information for you on how to alleviate those physical feelings. So I love this little graphic I found on Instagram about managing coronavirus anxiety. There's so much information now about specifically dealing with the novel experience of coronavirus. It has a little bubble here for you, and it has a lot of stuff that we've already talked about, but then it specifically talks about how to kind of help your children in managing their coronavirus, because they're really learning from you. They're watching you, but they're also taking the information that you give them. And then in the bottom, it's very specific information for how to deal with quarantine and isolation. Self-care may look different in the face of the pandemic, of course, making accommodations to be sure that, oh my goodness, no way. Sorry. Is that black? Give me a second, sorry. Okay. Making accommodations to be sure that you're following the health guidelines, and fulfilling your basic needs can really be difficult, meaning, you know, quarantining, wearing masks, socially distancing, but also maintaining fulfilling your basic needs. It's a hard balance. But a few small things every day can really help support you through that. And if you use this instead of substance, it can support you long term. I won't read those to you because I know you have heard me say them before.
And Teresa, just to kind of like throw another one in there, like practicing going with the flow. As we've all learned, that things come up when you're working from home. So, you know, learning to kind of go with the flow and expecting unexpected interruptions. So we appreciate your visitor.
Especially cute interruptions.
I'm glad someone appreciates him. So yes, thank you so much for that. I love that idea of going with the flow, accepting our situation and making the best of it, doing the best we can to support ourselves in it, and knowing that we can't have control over everything. So this slide I think is really great, because when students are listening to us talk, they're like, oh great, thanks professional, thanks person of authority, like tell me more. Well, what about when they hear it from their friends? What about when they hear it from a peer, someone they relate to? That's why I really liked this chart. It's from activeminds.org. They specifically canvassed high school students and college students on things that they found helpful in caring for their mental wellness during COVID-19. So here you'll see that they had plugged in a couple of things that the researchers thought might help. And you have a difference between, a small difference between college students and high school students, what they have found has helped. But what I think is most interesting from this study is the other category, what the students actually entered in themselves. And it's really so brilliant, the things that students will do to, or youth will do to care for themselves. Reading, going for walks, leaning into their religion, telehealth, binge watching. I mean, of course, it's 2020. Music, working on goals, getting outside, doing landscaping, doing homework. That one was questionable, but I appreciated it. I think it's really good to hear what students are using to cope with everything that we're experiencing right now. So,
Teresa, before you go on, I want to share a comment that we have in the chat. Remembering that we're all in this together and that you're not alone. So that's a huge coping skill to use and during this time, and sort of like a mantra to get us through this difficult time.
Absolutely. Community is key. Allie, were you going to say something?
No, just absolutely agree.
Yeah. So let's start this conversation about substance use. And you'll probably have noticed there's a lot of themes that I hang on to when we talk about certain things. I like to repeat a lot of stuff to help kind of drill it in and make you understand that this is important, and this is a key of being successful in understanding a risk of substance use, but also a key in understanding how to engage and have conversations about these things and to be successful at prevention. So let's be honest. Talking to your children about substance use. Honesty is the best policy. If you can really start from an honest core, everything coming from there is going to be helpful and honest and true, and there'll be no covering up or making sense of things. Except that this conversation is difficult. This is a hard conversation to have among adults. It's a hard conversation to have among youth peers, highlighting risks, talking about expectations. Accept that it's difficult and prepare to know that when you are about to have this conversation, you might have emotions come up. You might be at a loss of words. Someone might have an opposing opinion. Accept that. That is probably going to happen. Talk openly to your children about most things. This helps normalizing having a conversation about substance use. If you can talk to your kids about the Netflix show, or you can talk to your kids about breakfast, and have those conversations held regularly, having a conversation about substance use will hopefully be just a little bit easier. When you hold these conversations, make sure that they're based around facts, not your fears, not what you think it might be, actual facts. You can use this PowerPoint, you can go to the CDC, SAMHSA, and attend other workshops and share information with your youth, your child, people you care for. Being grounded and based in facts outside of your general knowledge is key. This, I think, is also really important. You want to ask your children about their friends, free of judgment, from a place of curiosity, genuine curiosity, wanting to know what's happening in your child's community. Many of them may have already experienced substance use. Ask your child their thoughts in their friends' behaviors. Remember not to put their friends down. Those friends are still important to your child, even if they're engaging in risky behavior. And judging them and putting them down puts you at risk of distancing yourself. It's important to be really clear and direct about your expectations.
I'm just going to add something there too, Teresa, and this is exactly where everyone should be at and having these conversations. And I think a big takeaway is that when these conversations happen, it shouldn't just be that one talk. It shouldn't just be that one big talk and then being like, woof, we did it, we're good, all right, high five. It should be frequent talks. It should be an ongoing conversation. And the more frequent, the more that kind of becomes a normalized expectation between you and your family. It's something that will, continually be in the back of your child's head if it's something that's always coming up or something that's always being discussed. And like you were saying, it kind of being clear and direct, but also making sure that it's a conversation and not you talking to them. If they're sitting down, you sit down. Watch your body language. Don't point at them. Don't, feel like you're giving them a lecture. It should be a conversation. It should be them asking you questions, you asking them questions. And I think that's what solicits the best feedback and making, your child feel most comfortable in sharing maybe something that wouldn't be so easy to share.
Absolutely, Allie. I love that idea you put in our heads of like holding a mutually respected space, a safe space, to be honest. I think that's so key. Thank you.
Thank you.
So I wanted to also point out that kind of piggybacking off of what Ali said, sincere praise of your child's efforts is going to go such a long way. Are they eating right? Are they exercising? Are they communicating? Are they engaging in therapy? Are they being grateful? Wherever you see them putting in efforts to maintain their well-being, acknowledge it. Tell them how great it is. Talk to them about it.
I love that, Teresa. Just want to kind of jump in there and just kind of say, I think oftentimes we forget, we focus on what's wrong and we try to correct that. And an effort that we could put more effort into would be validating what's going right, what's going well, and shifting that focus of conversations from negative to positive. And that positive reinforcement tends to have more positive results than addressing the negative things. So I love what you said there. And I just want to add a comment that was in the chat that preteens may need to be prompted to discuss what's bothering them. And I think I want to kind of expand on that and say, I think a lot of preteens, adolescents, I think people, I mean, I know many adults in my life who need prompting to talk about what's bothering them, and to normalize that it's okay to talk about emotions and to talk about what's going on for them, and to be able to say, you can come to me to talk about these things, and, I'm here to listen, is such an important thing. So yes, prompting is important in the beginning for, I think, many, many people, and making that a common practice in households can be very beneficial.
Yeah, I really think that touches on one of the slides we have coming up about modeling behaviors too, right? Like when we acknowledge that our preteens, they need prompting, but what would it be like if we showed them how to do it without actually saying, like, this is what you're supposed to do,
Right.
Just modeling that behavior.
Mm-hmm.
Break that down a little bit more in a little bit. It's a great question, a great thought, absolutely. So these are just some examples of how you can engage with your children about substance use. Of course, I only have 3 of each here. There's a million different ways to do this. But like we talked about before, being curious, genuinely curious about your child's community is really important. So you could ask something like, hey, I saw Sam at the coffee shop the other day. How are they doing? Like, you probably know that something's going on. But you want to know what your child thinks about their behaviors. And perhaps they are honest with you and they do tell you that there is substance use. Remember that non-judgment piece is really important. Holding space for them without putting their friends down is vital. It's nice that you are still in touch with Sam. What do you think about them drinking? You can gauge what they think about their friends drinking. You can gauge what the feelings are around drinking in general, or alcohol in general, and gather information on ways to best approach having these discussions with them. I really like the other examples here that we have here, but for the sake of time, I'm going to move on. So I think it's really important to discuss the opposite road in this conversation. talking to your parents about substance use. It's an equally important conversation, and probably an even more challenging one. So again, honesty is the best policy. Accepting that this conversation is going to be difficult is key. It's going to be hard. And I realized as I was creating this, I was like, I could totally have a whole slide here on difficult conversations and how to engage in difficult conversations. So I'm going to throw out a couple of tips. One of them, I think, is to know your facts and also to know how you feel about those facts before engaging in these conversations. Taking some really deep and relaxing breaths before you start to help reset, clear your mind. And then this one's my favorite, the power position. Has anybody done this? I literally did this before we started today because it's so useful. You just stand for 2 minutes, as big as you could possibly stand, make your body as big as it could possibly be for 2 minutes to help fill your body with confidence, clear your mind, and prepare yourself for the conversation coming up, for the difficult dialogue coming up. Side note, it works for interviews too. So let your parents know what your thoughts are about drugs and alcohol. And as those thoughts evolve, because they will evolve, update them, have that conversation. Ask your parents what their expectations are of you. Sometimes we don't know because they don't tell us. Ask them up front, what do you think my relationship with alcohol should look like? All of my friends are partying. I want to socialize, but I don't want to drink. What should I do? And I think this bottom line is so important. Practice telling your parents if you are in need of coping with difficult feelings. And then specifically, if you're using substances to cope with difficult feelings, without knowing that they can't provide other resources to help you. Another couple examples of how to engage in these conversations. I like this one. I know parents, you're probably cringing, like, oh, she's gonna have them put me on the spot. But like we talked about before, honesty is the best policy. It's really important to be open about these conversations to have a preventative effect. So mom, dad, grandma, grandpa, uncle, how come you drink or smoke? How is what you do different from what I should be doing? How do substances serve you? And maybe that gives you the chance to reflect. Maybe that gives you the opportunity to realize that you're modeling a certain behavior. And you can engage in an important conversation with your youth about how you ended up using the way that you do, whether or not it's use or abuse. Some thing to really consider is following up with questions about what the caregiver tells you if you are the youth or the child. I think asking, where can I find the information about what you've told me? I thank you so much for sharing what you've shared. Where can I find information to back it up? I think that kind of ties into what we were saying before about knowing our facts, knowing how we feel about our facts, not talking about our fears, but using true information. So then, of course, talking to each other. Allie touched on this perfectly before, holding that safe space for one another to really be able to open up and have open dialogue. Honesty is the best policy, except that the conversation is going to be difficult. It's going to be hard. Make a plan. As a caregiver, you can offer your child a ride at any time of the day or night if they feel uncomfortable because substance use is being used. Make a plan. The youth, your child, the person you care for can commit to telling you that they're becoming curious about certain substances. I'm wondering what it would be like if I had a glass of wine. We said this earlier, engage in regular conversations, normalizing engaging with each other, having conversations about anything, breakfast, mowing the lawn, the stars, just so long as you have an established line of communication. And really, most importantly, is to approach each other's thoughts and opinions with genuine curiosity and openness. And you do this in order to encourage future conversations. If you shut someone's opinion down, their feelings down, they're more likely than not gonna wanna talk to you, either about this conversation or about anything else. So really try to be genuinely curious about what they're sharing with you. I started thinking about this slide when our guest mentioned prompting, right? I think prompting is so important. Sometimes somebody needs to be asked a question. How are you feeling? What's going on here? You have to be clear and direct, right? But also modeling behaviors. If we exhibit healthy behaviors in our household, in our community, people are going to notice and they are going to follow suit over time. This happens especially when there's a power dynamic at hand. Say it's a caregiver and a youth, a senior and a freshman, someone who has a larger friend group than another. They hold power, and your behaviors impact people who are watching you. So lead by example. I won't go through all of this, I promise. So I broke it down a little bit about how parents can lead by example and how students, but youth, can lead by example. I love this thought. Like, you remember when your kid used to like pick up a shoe and just like have a conversation with Becky on the phone? Like, they sounded just like you. They were making sounds just like you. They probably weren't saying anything, but they were modeling your behaviors. And that is a core developmental event that happens throughout the lifespan. You know, we might not sound as silly as we did when we were talking into a shoe, but we're still modeling your behaviors. We're still a reflection of our role models, our parents, our grandparents, uncles, aunts, teachers. And with that said, as those with power, as the parents, as uncles, aunts, you're still being impacted by other people. You're reflecting other people's modeled behaviors. So it's important to keep that in mind when you move through the day and you go through the motions and other people are watching you. And for our youth in the audience, and for those who are thinking about them now who are here, remember that they are powerful. They have so much power over their community, over their friend group, their class, their siblings, their cousins. Just by, like we were talking before, people are unconsciously picking up on the things that you do. So if you choose healthy behaviors, and by choosing actions that support your well-being regularly, individuals around you are very likely to mimic it. I like this comparison. Like TikTok or Snapchat, right? Your friends will likely try to copy the activity to see how they like it. They want to try it on. Do I like this filter? Can I do that TikTok dance? I don't even know what the languages is, but they do things and it's cool. They want to try it on to see if it fits their experience in life. Modeling healthy behaviors, educating yourself and others on the impacts of substance use, and recognizing when others may be negatively influencing you are great ways of keeping yourself and your community healthy. Wow. So what are some ways you plan to model healthy behavior? I know that one of the ways that I like to model healthy behavior is by engaging in this manner as a student. I love to do these groups and gather information and share it with people. And I try to make it as palatable and engaging as possible. And I also am very aware of my use of alcohol at social occasions and know that it impacts people around me, specifically my family. So I try to maintain the standards and understand the healthy dietary choices I'm making.
I want to add something from the chat here that came up that I think I want to connect to modeling is so someone shared healthy eating will steer young adults from substance abuse, and I think modeling health, physical health in general, and creating a motivation to maintain physical health can really be helpful in these situations because we can talk to our kids about how these substances affect our physical health, and by promoting healthy physical activity, promoting healthy intake of food and beverages, can really help with promoting overall investment in physical health and hopefully act as a deterrent to putting things in your body that you that could potentially harm that progress that you're making. Also talking about like negative physical effects like hangovers and how that impairs their ability to function or achieve goals or do things that they might want to do the next day, how their choices their choices in the moment can physically affect or impact them at a later time. And that's something that I think can be discussed and modeled. Some other things that are coming up in the chat: never drink and drive. That's a huge one. Love that. Volunteer, participate in the community. Absolutely. The more you're doing those things, the less desire there would be to engage in other activities. Also, they improve your investment in other things, such as, like you said, the community, giving back to others. And if you're intoxicated or if you don't have the physical capacity to do those things, you're going to less likely to engage in use. Another comment I have is modeling healthy ways to decompress, and another one related to that is self-care. They're huge things. So when you take care of yourself, you are less likely to need those other things to do the same thing, to decompress or to escape from the feelings that you're having. And one final comment here that we have is try to force family time when the TV's off, the video games, iPad are off, and do family activities like walks or hikes where communication is going to take place more and the healthy dialogue can occur. And I think that's huge. I think increasing family time and promoting that as like a standard or a strong family value can be really important. Great comments, everyone.
Absolutely, yeah.
This is great conversation.
Absolutely. Thank you all so much for contributing and letting us know how you feel and what you think here. And some of those suggestions were really key. I'm thinking about, can I do a game night this week? I want to try and model that sort of healthy family engagement. I love it.
I think that's interesting too, Teresa, kind of what you just said, is that having these conversations really, I think, elicits that thought in ourselves, like, how can I bring this home? What can I do now? And just the action of just having these conversations and talking out loud and getting these thoughts out of our head, going back and forth, you come up with ideas for yourself and your family that maybe you didn't have before. And I think it's really important too for parents also to realize and everyone to realize that it's okay not to have all of the answers. So when you're having these conversations and you're having these back and forth with your kids, don't get freaked out if they ask you a question and you don't know the answer. I think it's important, like you said, to have that honesty and say, you know what, I think it's important for both of us to learn more about that. how about we take a look at this, or how would you like to learn more about it with me? I think that maybe we both can learn more here, because I think that it kind of brings both of you to the same level, and you're able to open up that trust a little bit more. Maybe your kid doesn't feel like you're talking at them as much. It's kind of a back and forth, and you're both be a little bit more honest about the fact that you have a lot more to learn too, and that nobody's perfect. You're not saying you're perfect and your kid isn't. Here's how you should be. It's an ongoing journey, and I think that that's important for everybody to realize. It's okay. It's okay to know that you don't know everything, because nobody does.
I love that. I love the concept of just accepting that you don't have the information and knowing that you have the ability to learn more and using it as an opportunity to engage with your child or someone you're caring for, to find that out and learn together. I love that.
That also made me think about something that I think is important to model, and it's just goal setting in general, for life, like and having a discussion surrounding how substance use or misuse could impact those long-term goals, because I think youth sometimes don't think in long-term ways. So trying to start that conversation about goals, and where do you want to be a month from now, a week from now, years from now, and let them explore how their current decisions could be impacting those goals in the long term. It's a good thing to start early in general.
Absolutely. Even for ourselves, even as adults, it's a good thing to reinforce.
Yep, absolutely.
Dr. B, I saw some comments come in. Anything we want to share?
Just thanking for the advice. And so, a comment says, in some of these matters, our children can teach us more than we can teach them. I love that.
Stellar.
We have to keep that in mind too, that in order for us to understand, we need to understand the current culture. We need to understand what the current pressures are. We need to understand what it's like. I remember growing up, it was like the motto was just say no. And I don't know if that works anymore. I don't know if that approach still stands. So maybe we need to learn from them about and problem solve with them.
Such an important point.
Unless we have some more comments coming in, I'd love to share some resources that Allie shared with me that I really found to be incredible. So, okay, we'll come back to this. So these are some of the resources I was referring to. When you receive this PDF, these will work as interactive links. You can click on them and open up each one of these to the actual website. And then you'll see at the bottom, I shared the OceansideSAFE Coalition resource page. But really their whole website is beautiful and filled with information and testimonies to the amazing work that they're doing. So I really suggest that each one of you check it out when you can, and to lean into this as a resource, not necessarily only when you're about to engage in a difficult dialogue, but at any moment when you're ready to expand and learn a little bit more about substance use and the impacts that it has on our community and us as individuals. And maybe in a moment where you're feeling a little extra stressed and impacted by the pandemic, just know that these are here for you in those moments. So Dr. Brady and I are from Molloy. We work at the Mental Health and Wellness Center there, where we serve the public. We provide many different types of services where you see our student clinicians there. We provide individual therapy for children, adolescents, adults, group therapy, couples therapy, family therapy, and workshops for staff and developmental training. One of the things that I love doing when I'm working with Dr. Brady in the Wellness Center are these groups, and there are so many of them, literally all the time. There is a group happening at some point, somewhere, talking about an amazing topic. And I think you can see here, we have our Facebook and Instagram listed. That's really where you'll be able to see Dr. Brady's really beautiful flyers that she creates and puts out into the social media ether, and hopes that people come and have these conversations and engage in these discussions with us. So if you're interested in receiving services or just coming to one of our groups, please refer back to this page, which we will send you, and give us a call. We'd love to work with you.
Yeah,
It looks like someone's interested in having you in the high school in the comments.
Yes, I saw that, Sarah. Thanks so much. Definitely, we do workshops for a whole bunch of different organizations, libraries, schools, organizations like OceansideSAFE. So if you're interested, or you know someone who is interested, please have them reach out to me. They can email me or give me a call, and I'd be happy to discuss any sort of opportunities for workshops. I want to thank everybody for coming, and really, you know, I'm so happy to have this partnership with OceansideSAFE and be able to reach the community. And we've had so many great participants in this group this evening. It speaks to how in touch OceansideSAFE is with the community, and that's so important. And I hope everyone continues to engage and really help to prevent this from worsening. And hopefully as a community, we can work together to reduce the use in the community and focus on creating more healthy coping skills and ways to reduce use for the wrong reasons.
Thank you, Kellyanne, and thank you, Teresa. You guys are unbelievable. We can't thank Molloy Mental Health and Wellness Center enough for partnering with us in this and supporting the coalition's efforts. Again, you guys are just unbelievable, and we're so, so grateful for you and for your knowledge and for your support. It means absolutely everything, and I 100% agree. You know, having programs like OceansideSAFE and having coalitions around the nation is pivotal in getting this information out there and having these conversations and starting these taboo conversations that are really difficult to have. And I think that the biggest takeaway here is that bringing it home to your own homes is step one. Having these conversations, learning a little bit more about the risks of certain substances, you know, changing that acceptance a little bit, and you know, kind of altering that climate that exists in your own backyard is one, but it's also about learning a little bit more about how to really do that on a community level. How do we implement programs? How do we get our police precincts involved? How do we get different youth organizations involved? How do we tie all these different sectors of our community together? That way it's coming in from every single angle. Businesses are involved. It's a different way of advertising. It's a different way of putting different messages out there. It happened a lot with, you could see with cigarettes, the way that cigarettes were accepted years ago. And now there's just campaign upon campaign showing the truth about what it does. So we see that these things do work. It takes a long time in some cases, but the more people that you have involved and the more buy-in that you have from your community members, the more effective that's going to be. So if this is something that everybody cares about, and it is, I mean, the health and wellness of our youth, the health and wellness of our communities, everybody should be worried about that all the time. So if that's something that you're passionate about, learn more about our coalition, learn more about how you can get involved individually, how you can bring this to, you know, your school, how you can bring this to your business, how you can bring this all over, and it will make a difference. It's a what do they say? It's a marathon, not a sprint. So we just have to be patient, but really put the efforts in.
Love that.
Absolutely, Allie. Thank you both so much for having me, and it's an honor to be a part of this movement and efforts today. Thank you.
Thank you. And thank you everybody for being here.
Yes. Thank you all so much for coming. We really appreciate it, and we hope you enjoyed. If you have any questions, feel free to reach out to either us or to Oceanside Safe, and we'd be happy to provide you with resources. If you want to get the PDF, either reach out to Allie or myself. You have my email right up on the screen here, mhwc@molloy.edu, and we'd be happy to provide you with that PDF version of this presentation with all the resources available to you.
I just put our email also for Oceanside Safe in the chat if anybody wants to reach out to us as well.
Great. And for anybody who, just in case anybody's listening, it's info@OceansideSAFE.org. So thank you, everybody. I hope everyone has a great evening. Thank you for hanging out with us. We had a lot of people stay. So I'm really glad that you were able to stay for the whole time, and I hope everyone has a fantastic evening. Thank you, everyone.